Welcome back to Med-Surg Tutor. Today we're breaking down something every nurse uses, but many nursing students aren't taught well enough. SBAR communication. Whether you're in clinicals, prepping for the NCLEX, or already on the floor, this video will help you report like a pro. Let's get into it. So, SBAR is a structured way to communicate in healthcare. It helps you deliver important info clearly and quickly, especially during handoffs or when calling a provider. The letters stand for identify, situation, background, assessment, and recommendation. It's not just about sounding professional. SBAR reduces errors, improves patient outcomes, and makes sure nothing important gets missed. Plus, you're more likely to be taken seriously when you communicate clearly and confidently. So let's start with identify. Here, this is where you introduce yourself and identify the patient. Super simple, but don't skip it. So, what you want to do is say your name, title, unit, identify the patient's name, their date of birth, room number. Most of all, here you want to be confident and clear. So, let's start with this example. Hi, this is Nurse Jackson from Med-Surg unit. I'm calling about Mr. Alex Rivera, date of birth 4/12/1960, in room 312. Here we check off all the boxes when it comes to identifying. What you don't want to do is assume the provider knows who you are. Don't skip over the patient ID and don't speak too fast or mumbled. Remember, we want to be clear and confident. Next, a situation. Here, you're just telling them why you're calling. What's happening right now? What you want to do is be direct. This is what's happening right now. Mention time frame and urgency. Use clear clinical terms and avoid that vague language. You want to be specific as possible. So here we would say something like Mr. Smith is experiencing new chest pain and shortness of breath that started 10 minutes ago. This is super specific and it gets to the point of what's happening right now. What you don't want to do is give a full story or background yet. Don't ramble, just get straight to the problem. And don't assume the provider knows what's happening. Guys, we want to refrain from assuming anything. Now, background. You're going to give context. Why is this happening? What's relevant about their history? What you want to do is include diagnosis, date of admission, and any important past medical history. Mention recent procedures, labs, or vital trends if they're relevant. So, an example of what we would say when it comes to background is he was admitted yesterday with pneumonia, history of COPD and hypertension. O2 stats have been dropping since this morning. This is a perfect example of background. What you don't want to do is tell their entire chart. Don't include a relevant history. Stick to what's related to the current issue and why you're calling. Don't guess. Use facts from the chart. You have all the data, you have all the vital signs, you have the history, you have the labs. Use that to your advantage when giving SBAR. Assessment. Here's where your nursing judgment comes in. What do you think is going on? Here, you want to give your impression of the problem. Include those vital signs, physical findings, or any changes. Speak confidently. Your observation here matters. You're the nurse, you're the one taking care of this patient. So, an example of what we would say is I think he may be developing acute respiratory distress. His O2 sat is 88% on 4 liters. Respiratory rate is 28, and he looks pale and diaphoretic. What you don't want to do is say, I don't know, without offering observations. Don't skip this step. Your input is valuable. And don't use vague terms like he doesn't look right. You want to be specific as possible when you're communicating with other people on the healthcare team. Recommendation. Now ask what you need. Be direct but respectful. What you want to do is be clear and direct about what you're asking about. Ask for specific orders, interventions, or assessments. Offer helpful suggestions if appropriate. So, an example of this would be, can you come assess the patient and consider ordering a stat chest x ray? What you don't want to do is don't end with, okay, thanks. Don't assume the provider knows what you want. You're calling them about the patient. You and the provider should be on the same page as to what the next step is for the patient. And again, don't be vague, be specific and purposeful. All right, so now let's put all of this together. So, as if we were calling a provider, this is how our SBAR would kind of look. Hi, this is Nurse Jackson from the Med-Surg unit. I'm calling about Mr. John Smith, date of birth 3/14/1955, in room 312. He's experiencing sudden chest pain and shortness of breath that started about 10 minutes ago. He was admitted yesterday with pneumonia, history of COPD, and hypertension. His O2 stats have been dropping since this morning. I think he may be developing respiratory distress. O2 sat is 88% on 4L, respiratory 28, he's pale and diaphoretic. Can you come assess him and consider ordering a stat chest x ray? All right, that's our SBAR. We went through the steps individually, and this is what it looks like when we put it all together. So I want to leave you guys with some tips. Always write your SBAR out before calling. It helps you stay clear, organized, and confident, especially if you're a new nurse or this is the first time you've written a SBAR. It's good to keep all your thoughts together because, as you can see, this is a lot of information to be remembering. Stay calm, speak clearly and professionally, especially during emergencies. You want to be confident and you want to be able to communicate clearly, and you can't do that if you're not calm. Listen carefully to provider responses and repeat back orders. This is also a good tip to have like pencil and pen or paper and pen nearby so when you're talking to the provider, you can jot down anything you two discuss. But repeating back orders is also helpful. Use SBAR to organize, select all that apply, and prioritization scenarios. So this can even come in handy when you're taking those exams. Alrighty guys, that's all for this video. Happy studying.